20 or 30 years from now, people will look back and wonder, what in the world were they thinking? Why would there have been such diverse use of opioid drug therapy? In the midst of this opioid crisis, and by crisis, in part what I mean is that even veterinarians are finding themselves limited in their ability to prescribe opioid type medications and medications that are adjacent to but not directly opioid pain medications because of the overprescription of these types of medications to humans. We're going to explore today why use of these pain medications fails most often, and we're going to describe why other therapies help with pain resolution in a more sustainable and permanent manner. So what exactly is pain? When we think about it, pain is the sensation of pain, right? It's a disruptive action in the nervous system that is usually limited and is mainly felt at higher levels in the brain stem or in the cortex. The relationship of pain to learning has already been taken for granted in some cases, and we can see it in the way we train animals. In the assumptions that certain afferent processes act primarily to disrupt central activities. In other words, we use certain painful stimulus to change behavior. Disruptive processes are a general classification that includes more than pain. In most sensory modes, there's an intensity at which avoidance appears. Below this point, the stimulation may be sought out. That is, it is pleasant. Above it, the same kind of stimulation produces avoidance. And if the avoidance is unsuccessful, behavioral disturbance will occur. What does this mean? This means that sometimes we use pain as a means of getting things from our animals that we desire. So what else would we consider is really pain? The intensity of pain is not dependent on the amount of force that's applied to the body. Some areas only require a small amount of force to elicit large amounts of pain. Neurons, the wires in the body that send signals to the brain, let the brain know when some sensory stimulation occurs in the body. The brain can decide if this fits the order of things and then sends a message to the body to either change the actions occurring in the body or continue the actions or even stop them. Intensity in neural terms must be a matter of impulses per second. And there are neurons called C fibers that are the very ones in which conduction is the slowest. So their impulses per second are at the lowest number. And these deliver the fewest number of impulses per second at any one point in the nervous system. Increasingly, the pain can also send signals to the body to let it know that something interesting is happening in the brain. So C fibers, which are considered pain fibers, are very slow, and sometimes the system will also send signals from the brain to the body that says this might be painful. Sometimes what is interesting to the brain alters what is happening in the body, like a motion occurs. This is called motor function. And motor function changes how pain is perceived. Pain is a disruption of previously learned neural activity. The brain doesn't really have a name for this, but we can assign a name to the sensations, and we call that pain. A big part of the brain and nervous system's job is to keep us alive. When one of these signals is interrupted, as meaning our life is threatened, then the brain acts to resolve the issue. When we feel pain, the brain acts to move us away from the painful stimuli. It has been shown how pain might control learning by disrupting one phase sequence, leaving another unmolested. Essentially, this is a limitation of conceptual processes in a given environment. Pain, then, is a means of channeling motivations. It's not a source of learning from this point of view, but limits and directs it. However, pain does have an energizing effect on behavior, and in some circumstances, it appears to facilitate it. There is no one place in the brain where pain sensations are all located. There are special receptors for pleasure, and these receptors are called opioid receptors. When we feel pleasure or reward, these receptors light up and the brain actually resonates in a harmonious vibration at about 40 hertz. This is when we feel that light coming on in our brains, and in our language we refer to it as being the light comes on, or being brilliant. I class pain then as a disruptive somastatic event. The disruptive action is usually limited and is mainly at higher levels in the brain stem or in the cortex. At the spinal level, tissue injury may arouse only integrated reflex responses. As the thalamocortical level, the disturbance must still be focal, since the course of pain is referred to specific parts of the body. Its effect may be widespread, but if the disturbance becomes really general, it is perceived as emotion and not pain. There have been, in general, two theories of pain. In one, pain is not a special sensory mode, but an effect of overstimulation of receptors from heat, cold, or pressure. In the other, pain is a sensory mode with its special receptors, peripheral nerve fibers, and conduction paths in the spinal cord. Each of these theories has its difficulties, and each has something to recommend it. The two seem to have been thought of mutually incompatible until now. If one is proved wrong, most people think the other must be right. But following up a suggestion made by Neff in 1934 and making a comparatively small change in each theory, we can find a way of combining them. The combination has been the best features of both and covers certain facts that may be equally destructive of either theory by itself. Finally, there is no specialized cortical area for pain, as there is for touch, and apparently no specialized pain nuclei in the diencephalon or lower brainstem. If specialized tracts for the conduction of pain do exist, what do they conduct to, other than the centers of somaesthesis? Taking into account the two theories on pain, against the first, peripheral intensity theory, is the existence of pain spots in the skin, where a weak stimulation can arouse pain, although a much stronger stimulation elsewhere does not. Pain seems to also depend mainly on the activity of C fibers in the sensory nerve. This itself denies that intensity is all that matters in pain, but even more, intensity in neural terms must be a matter of impulses per second. And C fibers are the very ones in which conduction is slowest and which deliver the fewest number of pulses per second to any point in the nervous system. However, there are strong arguments against the alternative sensory mode theory. If pain is a sensory mode, it's known that its receptors must be free nerve endings, and free nerve endings are also known to mediate pressure. There may, of course, be two kinds of free nerve endings, histologically indistinguishable. However, very weak or very brief stimulation of pain, spots of pain, or pain fibers produces no pain. Naif points out in 1934 that this obligated supporters of the sensory mode theory to hold that there may be non-painful pain. If we consider an organ, such as a sound tooth, that contains pain fibers, but has never been the site of pain, we can hardly suppose that there are normal nerve fibers that have never once been active over an individual's lifetime. If we suppose that they are active, but at a low level that is not recognized as pain, then we have conceded that the activity of the pain fiber does not essentially mediate pain, and the alternative is to suppose that inhibitory action of other fibers has throughout a lifetime prevented the occurrence of pain. It's very doubtful that the inhibitory process can be so uniformly and continuously efficient. In 1928, Pavlov, and then again in 1944, Ledel, have shown that the disturbing effects of cutting and burning a dog's skin disappear completely when the pain stimulus is regularly followed by feeding in a conditioned reflex procedure. The transformation from typical pain responses to feeding responses was gradual. Once it was established, there was an immediate relapse when the site of pain stimulation was changed to a new part of the body. In 1934 and 1938, please keep in mind these were before we had more humane treatment of animals in laboratories. Mutzinger and Drew had given a rat electrical shock for the correct response, which followed by a course of food, and found that it increases the rate of learning. In Drew's experiments, when the food itself was electrified, so the rat got a shock every time it took a bite. Because the rat was already preconditioned, it ate more quickly. In such a case, once the central effects of pain stimulus have become organized, we must regard the stimulus as essentially motivating. Just as a blow of a whip may be motivating and energizing to a racehorse that appears already to be exerting himself to the utmost. A further stimulation that adds to the effectiveness of a pre-existent cerebral control of behavior helps to increase that behavior. Another example is when our brains can experience an emotion that causes a physical pain in our bodies, and yet we will stay in that emotional state because we feel we are getting a reward for it. Or we can overcome incredible pain in order to achieve great love or express great love, such as birth or saving the life of another. When the brain is wired, it does so as a result of the sensory input it experienced as it grew. If this input is faulty or painful, it will wire to see that as normal. any learning experience can be wrong. Learning is a painful sensory issue. It requires rewiring of our understanding of things. Your learning of this information may be painful because it seems to go against what you have already learned. Learning a new subject can also be very painful. Donald Hebb described it this way. Disruptive processes are a general classification that includes more than pain. In most sensory modes, there is an intensity limit at which avoidance appears. Below this point, the stimulation may be sought out. That is, it is pleasant. Above it, the same kind of stimulation produces avoidance, and if the avoidance is unsuccessful, behavioral disturbance. With different kinds of stimulation, the avoidance limit falls in a different part of the intensity range. Pain is not unique, but may seem so partly because there's a great range of intensity above the limit of the initial avoidance. Pain, therefore, as a particular class of event, is regarded here as a disturbance, origination in the somesthetic afferent system, although its mechanism may be like that of disturbance originating from certain sounds, smells, or tastes. When pain is felt, which is the disturbance of any neuron, physical pain can be the excessive stretch of joint mechanoreceptors or the breaking of skin and thus tearing of the neural end points. Emotional pain can also result in physical pain, as it too disrupts the neural input to our brains. We localize pain sensation because of how our brains like to assign areas of our bodies to areas of our brains. When we are rewarded by love or food or other things that fire our opioid receptors in our brain, then our brain will begin to assign the painful sensation to the result of pleasure, and we will begin to actually seek out that same sensation scenario, knowing that it will culminate in the firing of our pleasure centers. Animals can be taught to do this as well. There are no actual pain fibers or pain locations within the brain. The brain itself feels no pain. Stretch fibers in the dura mater and periosteum of the skull signal stretch and pain reception to indicate pain in the skull. But a headache is not an ache of the brain, though it can be caused by swelling of the brain, fluid within the cranium, or blood flow blockage that surrounds the brain itself. In our functional areas of the cerebral cortex, we can see particularly the association cortex toward the back of the brain in light blue. This is the area through which sensations of pain are decoded. Addiction is the result of a desire to fire those pain receptors continually. This can be a process of pain, pleasure, reward. This is true of physical pain, emotional pain, or chemical pain. Any sensation that repeatedly fires opioid receptors will result in the association of pleasure, even if it begins with pain. The most rewarding situation for the nervous system to find itself in is to respond to motor function with pleasure. This means that when a baby is learning to crawl or walk, it gains stability and its muscles get stronger as the motor function improves. Its pleasure centers light up as the baby attains what it sought. When we lose a loved one, our relearning to do our daily tasks can be painful because we are unlearning or reorganizing our neurons to fire in a different way. So when we attempt to medicate pain, we often fail because pain is based on what the brain and body have decided is their normal. And they can rewire and relearn to reset this normal as often as needed. Pain medications work to turn off receptors that may be transmitting sensory information. However, as we said before, the sensory information may be originating in a piece of neural real estate that is distant and not easily localized to the area in which the pain is perceived. So you can see that allowing the nervous system to clear its own clutter is more effective than trying to cover up a set of receptors that might be causing the issue. For one thing, covering the receptors has to be repeated. Aligning the nervous system need only be done often enough until the body learns the new pattern. Once the body relearns to operate pain-free, then it can maintain the sensory information of pain. With pain medications, one, there are also alternate pathways the body must develop to circumvent the medications and its side effects. And two, when the pain medications are removed, the body will continue with a nervous system that is still in dysfunction. And three, pain medication, similar to pain itself, decreases sensory activity in all nerves, including the pain fibers. The threshold of pain does not decrease for pain sensation. In fact, it is raised. Pain medications non-specifically reduce sensation to all nerve fibers, not just fibers mediating pain. They block the effects of prostaglandins at the level of the cord, also blocking the effects of the Golgi tendon apparatus and dampening the ability of the body to safely respond to changes in the environment. Why is it that Tony Robbins can get thousands of people to walk across burning coals without damaging their feet? He does it because those people have changed how their brains think about the sensation of burning. The sensory input of burning creates a euphoria for them, a super lighting up of the pleasure opioid receptors in their brains. This is just one step from making them seek out more hot coals every day. And then the hot coals become just a metaphor for other painful situations in their lives that they once thought were insurmountable, but that they can now overcome because they have learned to associate accomplishment with pleasure rather than pain. This is not unlike the dog who wears a collar and has an invisible fence in his yard, but can overcome the brief sensation of painful stimulus in order to get out of his fence. However, this can result in a dog who will not come back into his yard because the pleasure that he affords coming back in is not as great as that he attained by leaving. The brain reassigns its real estate as it sees fit. An amputated arm no longer needs its brain real estate, so that property is often assigned to the face. Now when the face is painful, the arm is perceived. So too can this occur even when the body part is still attached. Often trigeminal neuralgia is the pain of the GI tract being expressed in the skin of the face. We see it in animal patients who are expressing this kind of pain as a form of repetitive behavior, such as fly flicking, chomping at flies that don't exist, and flipping their heads up in the air, up and down repeatedly, as though there were flies on their face. If we have a nervous system that is working well and without disruption, then pain fibers or pain sensations can be dealt with readily and easily. Recovery from painful situations, such as a lengthy workout, can be easily completed. The reason chiropractic is the most effective method of pain relief lies in the fact that its only job is to realign the nervous system, to remove the disruption of the neuron and allow the brain and spine to communicate flawlessly with the body. This is also why chiropractic adjustment aids in learning. The adjustment allows the speed with which the neurons realign themselves during learning to be completed more quickly, thereby reducing the painful portion of the experience and achieving the harmonious part faster. There is no faster way to brilliance. When the brain is able to make choices whether to perceive an activity as painful versus leading to pleasure, it has an advantage in that it can also enjoy a healthier, longer life. If the person or animal or brain chooses to perceive all activities as painful, then the stress and detriment to longevity will be obvious. Animals understand that focusing on a task that takes higher priority reduces the sensation of pain. This leads us to believe that animals' priorities for survival differ from humans. Avoidance of pain is not as high on their priority list as it is on ours. Seeking pleasure, food, and survival of the species is more important for most animal species than pure avoidance of pain. Through chiropractic treatment, animals are able to behave in a manner that allows for better choices and for continued expression of their priorities. Even humans who choose to expect the worst experience have shorter lifespans. When humans perceive that even difficult pain will be worth it in the long run, they endure greater hardships and enjoy longer lives because they are better able to regulate and align their neurons when they become more disorganized. They also get better at it with practice. Thus, their ability to learn is increased, which leads to greater protein synthesis within the nervous system, continuing to make them stronger. While pain may be coming from the diffuse changes in neurons caused by a single injury, it is divergent. Nerves of pain are slow. They stimulate all of the tissues surrounding them. Pleasure evokes friendly, outgoing behaviors. Animal behavior becomes more pleasant, more congenial, and these animals are easier to train. Reduction of pain is necessary for surviving as a species. When an animal only has a focus on itself, It can only protect one animal. When the distraction is not a distraction but a means of allowing the body to heal, then the animal will improve its ability to survive as a species. All animal species are subject to the laws of the universe. The most obvious of those is gravity. A reflection of the normal response to gravity is what we see in the animal. The response to gravity determines health throughout the body. The response to pain, or the buffering of pain, also determines the health of the body. And the health of the body determines whether or not an animal can respond in such a way as to make those determinations. These forces of nature, the environmental stimulus that create behaviors, determine what an animal will be and how its species will survive and in what environment it will survive. With the power of the brain, we can choose to focus on, pay attention, or completely ignore pain signals. Consider that wearing clothing is one of those signals we choose to ignore as an irritant. Along with some odors, clogged nasal passages, headaches, annoying music, things that reduce our ability to focus and complete our more pressing desires. By allowing the nervous system to have open access to flow, we gain the power to determine what we wish to acknowledge and what we wish to suppress, just as animals have done for eons in order to allow their species to survive and to develop into the types and species and subspecies they are today.